talking about Trump not having the power to compel all 50 states to do what he wants them to do. And he's right. And I've been looking at the most serious pandemic, arguably the most serious one in the world, in the history, and that's the 1918 pandemic. And I was looking to see how different states dealt with the pandemic. And there's a very, very long piece in the Public Health Chronicles called Public Health Reports about how Minnesota, especially two cities, St. Paul and Minneapolis, dealt with this. One, far more draconian measures of mandatory shutdowns and things like that, and one city didn't. So they can compare and contrast which one saw a lesser problem with the so-called Spanish flu, which was really misnamed. Here's what this paper says. We've had influenzas, by the way, occurring regularly every 30 to 40 years since the 16th century. Today, influenza experts consider the possibility of another influenza pandemic, not in terms of when, not in terms of if, but when. By the way, this paper was written in 2007, okay? Now, when the influenza first appeared in Minnesota on September 27, quote, the state was ill-equipped for a health crisis. Many physicians and surgeons had gone to Europe or to training, so there were very, very few medical professionals. The number of patients overwhelmed St. Paul and Minneapolis clinicians. A lot of health providers fell ill, some died. Quote, at one point, Minneapolis City Hospital reported that nearly half of the nursing staff had been ill with influenza in the last 3 weeks. This bleak situation discouraged some from providing their services, end of quote. Said that Minneapolis and St. Paul hospitals proved to be inadequate to handle the large number of patients. Plus, they didn't know a lot. 1918 medical science thought that the influenza was bacterial in origin, not a virus. Didn't have the ability to examine something that small in those days. Quote, nevertheless, despite this lack of understanding about viruses, the advice to curb the infection was relatively accurate. Cover sneezes, cover coughs, plenty of fresh air, avoidance of sick and avoidance of crowds, and contact a physician if ill. Pretty much the same kind of advice we're hearing now. There was disagreement between the Minneapolis and St. Paul health commissioners. One felt that it should be mandatory to limit crowding in places. Others did things on a far more voluntary basis. St. Paul targeted elevators. There was some closing of public spaces in Minneapolis. And by the way, it was announced in advance, so people rushed to complete the activities that would soon be banned, quote, resulting in the very same crowded conditions that the ban sought to prevent, end of quote. So downtown theaters were packed last night, wrote one paper, with patrons who took advantage of their last chance to see a performance until the ban is lifted, all of which created the opposite effect of what the ban was designed to do, which was to stop people from crowding together. So what people did was rushed to get their last chance at participating in whatever activity they wanted, making things worse. Many sporting organizations, it says, responded negatively to closing orders. Bowlers drew up a petition that requested permission to bowl again. Elevator regulations were particularly unpopular. Some downtown hotels objected to stopping their elevators, saying that they would lose guests. School boards often were defiant. One was especially defiant, the Hennepin County School Board, where Minneapolis is located. School board was concerned for the health of students, as well as the, quote, $12,000 a day, close quote, that closing orders would cost because teachers continued to be paid and extra school days would have to be added to the school year. In St. Paul, all cases were supposed to be reported to a doctor, who in turn was required to isolate the case in his or her own home and notify the health department. Several problems sprung up with these requirements. For one, doctors and patients were often hesitant to bring attention to cases. Physicians were not reporting the cases to prevent homes from being quarantined. There were difficulties involved in establishing isolation. Directions for wearing masks were issued to the public. Outside, face mask. Medical students were wearing masks. Despite the warnings of shortages, many people were trying to get masks for themselves.